Next we will have a speaker, a TED Talk speaker, a TEDx speaker. She's a clinical psychologist and a leading voice in mental health who will talk about a mental health roadmap. She is Dr. Brianna Gaynor, and hopefully we'll get her on now. There's Dr. Gaynor. Thank you for being with us and take it away.
Hi, everyone. Thank you so much. I just want to thank Paula, Pam, and the entire organizing team for having me today. I want to start by acknowledging you, the patients and the caregivers. We just heard Dr. Obi give an incredible talk about fatigue and the quality of life. And I know from my work at my practice, Peace of Mind Psychological Services, that when you live with a condition like sarcoidosis, the fatigue just isn't in your body, it's in your mind and it's in your spirit. You woke up this morning with sarcoidosis. You didn't choose it, you didn't invite it, but you are carrying it. And often the heaviest part of the load isn't just the inflammation in your body, in your lungs or your eyes or your skin, but it's the invisible backpack every day. And inside of that backpack, there are rocks of uncertainty. And so, wondering if you'll have a flare tomorrow, grief, maybe missing the person you were before the brain fog, or having lost someone to this condition, and then isolation, because no one really understands the struggles that you have on a daily basis. And so, my role today as a clinical psychologist and as a speaker isn't to tell you to just think positive, but I want to actually give you a roadmap. So, let's do a practical guide for navigating the terrain of this mental journey. And so, because this is a virtual conference and I know Zoom fatigue is real, I need you to do two things for me first before we get started. The first thing is unclench your jaw. And then the second thing is drop your shoulders just an inch. We're going to take the next 20 minutes, not as a lecture, but as a deep breath for your brain. So, let's talk about the elephant in the room, or the intersection of the body and the mind. There is a biological reality that we must validate. We know that sarcoidosis is an inflammatory disease, but inflammation in the body also equals inflammation in the brain. And so when Dr. Rhonda McCullough was giving her opening remarks, I was nodding because I want to add the psychological piece. Fatigue, listen closely. Fatigue is not laziness, and brain fog is not a lack of intelligence. Shortness of breath is not a panic attack, although it can trigger one. So, the first step on our roadmap is normalization with agency. You are not weak for feeling anxious about a lung function disease. You're a human with a nervous system that is on high alert. And so I want to introduce a concept that I talk about a lot at Peace of Mind, and it's called the pacing pivot. So in psychology, we have a term called the window of tolerance. And for a healthy person, that window is wide open. But for a sarcoidosis warrior, the window is narrow. So if you push too hard physically, so you clean the whole house, you will crash. But you don't just crash physically, you crash mentally too. That brings guilt and negative self-talk. So having thoughts like I'm useless and I can't do anything right. So the first thing I want to encourage you to do is to change your metric for success. In sarcoidosis, success is not 100% completion of whatever the task is, but let's look at it as 70% exertion. So for example, if you think you can walk 20 minutes, walk for 14 and then rest. Or if you think you can work 3 hours straight, do 2 hours instead. And why 70%? It's because the remaining 30% is the energy you reserve for joy, for emergency, or just simply to be present. It's the energy you use so that you're not snapping at your partner at the end of the night or crying in the floor with exhaustion. Because living with sarcoidosis means you stop borrowing energy from tomorrow to try to feel normal today. So, the first part of our roadmap, or the next part, is a mental toolkit for the sarcoidosis spiral. And what I'm referring to is the spiral we all know. It starts with a twinge in the knee or a cough that won't quit. And then the thought comes, is it back? Is it spreading? Is it neurosarcoidosis? Did I do something to cause this? As a motivational speaker, I could tell you to look on the bright side. But as a clinical therapist, I want to give you the real tools to stop this spiral in the moment. And it's what I call the STOP method for sarcoidosis anxiety. The S stands for slow the scroll. So When you start to feel the panic rising, do not Google. I repeat, do not Google. Do not open a new tab because your 3 a.m. brain cannot differentiate between a 1998 case study and your current reality. So instead, let's practice something. I want you to put your hand on your chest. I want you to breathe in for 4 and out for 6. Let's try that one more time. In for 4, out for 6. The long exhale actually activates your vagus nerve, which tells your body that you are safe. The T is for tagging the thought, not fighting it. So instead of saying something like, I'm stupid for worrying, I would say, consider, I'm noticing that I'm having a thought that this is a flare. Labeling the thought as just a thought takes away its power. It's the difference between being in the storm and watching the storm from the house. And then O stands for observe with curiosity, not judgment. Sarcoidosis teaches us to be hypervigilant. So we're always scanning, which is exhausting. So shift from scanning to observing. So something like, interesting, my body is feeling heavy today. What does it need? Is it water? Maybe rest? Or maybe it's the last step, which is the P, which is proceed with a small kind action. So that does not mean proceed with a to-do list, but it's a kindness action. So it's maybe I'll make a cup of decaf tea, or I'll watch 5 minutes of a funny video, or maybe I'll text my friend and ask them how they're doing. But those small actions help to stop the spiral and ground you in reality in the present moment, which quite honestly is all that we can control anyway. And so now I want to step or I want to focus on something that's deeply personal, which is called the loneliness of the invisible illness. So you look fine can be a double-edged sword for sarcoidosis because people can see you at the grocery store and think you look great, but they don't know that 30 minutes later, you're lying on the floor in exhaustion. So while Dr. Culver and Dr. Sharp are going to talk about the medical side of being heard, I want to reiterate the emotional side of being heard. So the next stop on our roadmap is navigating the social landscape. And the first thing I want to suggest is a prescription for support groups. The conference agenda has a patient support group at the end. Please use it. I cannot overstate the power of a Zoom meeting where you can say, I have a weird pain, and 50 heads will nod in agreement versus people being confused about what you're talking about. Community is just not a nice to have, but with a chronic illness, it is an evidence-based medicine for the soul. It reduces your cortisol, which is your stress hormone, and it helps to build resilience. The next thing I want to suggest is a script for loved ones. So your family wants to fix things, they want to help you, they want to make it all right. And so their intentions are great, but sometimes that can be frustrating when this is not something that can be fixed. So what about if we told people exactly what we needed? So something like, I know you want to make this better and I love you for that. But right now, I don't need solutions. I just need you to sit with me in the fog for 10 minutes. Can you do that? And then the next thing is protecting your peace, which is all about boundaries, which are the ultimate act of self-compassion. And so sarcoidosis has given you a new non-negotiable filter for your energy. So some suggestions of boundaries would be saying something like, I can attend the family dinner for 45 minutes via Zoom, but I cannot come in person. Or I'm going to mute this group chat because the notifications are increasing my exhaustion. That is not selfish. It is strategic self-preservation. Now I want to go to another part of the roadmap that we forget to draw. This map doesn't just belong to the person with the diagnosis, but sarcoidosis is a relational diagnosis. It happens to you, but it also echoes through the people who love you and treat you. So first to the caregivers and loved ones tuning in right now. I see you. I know perhaps you're off camera and you want to get it, but the truth is you're also carrying a unique invisible backpack as well, which is filled with anticipatory grief. So mourning the plans you had that had to be changed and helplessness because you cannot fix what your loved one is struggling with. And also compassion fatigue because you're doing all the things. You are managing medications, appointments, the household mood, and you may forget to eat or shower. And so here is your prescription. And I want you to write this down as if you were giving a script to a pharmacist. And that is, you cannot pour from an empty cup. You cannot be a stable anchor if you are drowning too. So please hear me and consider these things. Take a 15-minute walk by yourself, attend your own therapy session, or sometimes just saying, I need a nap before I can help you with that are all important things that you can do that are not selfish, but sustainable love. Because if you burn out, now we have two patients instead of one. I also encourage you to find a caregiver specific support group. The Sarcoidosis Research Institute has resources for you too. You need a space where you can say, I'm tired of being the strong one without feeling guilty and with people who understand exactly what you're experiencing. And now I want to talk to the medical staff, the nurses, the coordinators, and fellows listening today. You are the translators of this complex language. And I know the system is hard to practice. In this system, it's hard to practice the kind of medicine that you dreamed of. But from a mental health perspective, I want to give you one clinical pearl that I think will change your patient interactions. And that is to not only validate the experience, not just the symptom. Let me say that again. Validate the experience, not just the symptom. So, for example, instead of saying your PFTs look stable, see you in 6 months, it could be something like your numbers look stable, but I know numbers don't always match how you're feeling. Tell me how you're really doing. That one sentence is a mental health intervention because it builds trust, it reduces the trauma of feeling unheard. And for you, it helps to stop the feeling of feeling like a cog in a machine, like you were just doing the same thing over and over, to let you know that what you do does matter. It's making a difference and it also fills your cup. And so the goal of mental health is to reclaim the steering wheel of your life, even when sarcoidosis is in the passenger seat. Remember, you are not a patient who's waiting for things to get better to live your life. You are a person who is living with a challenging and dynamic condition. And within that living, there is space for, number one, that mindset shift. So changing to the 70% rule over crash and burn. So 70% exertion, not 100% completion. Save your energy. And then the second step is that stop method for when anxiety hijacks the ride to really build resilience. So once again, the stop method, the S stands for slow the scroll. T is for tag the thought, but don't fight it. O is for observe with care and not judgment. And P is proceed with a small, kind action. And finally, community. So allowing others to hold the mat when you're too tired and letting people know exactly what you need. Because the truth is, if people don't know what you need, they're going to do what they think is best. And sometimes, a lot of times, that's not working. And so I see you, I hear you, and I applaud your courage for showing up today to learn, especially when you're tired. So thank you for the honor of sharing this time with you. I know I covered a lot. So if you are overwhelmed, what I would say is the one thing I want you to take away is start with the 70%. Just do that this week. Rest now, hydrate because you did the work today. Thank you so much. I do want to mention one more thing. There, you are going to get an email on Monday with some resources that I want to share to help with the mental health journey. So make sure to check your emails on Monday. Thank you so much.
Thank you so much, Dr. Gaynor. That was excellent. That was really good advice for everybody, not just sarcoidosis patients, but that can be used across the board. Um, one person was asking about journaling. How important is journaling in your mental health stability quest?
Journaling is an excellent way to express yourself. The truth is, it's really about how you get your feelings out. There are some people who just want to talk it out. There are some people who use art and some people who use journaling. But I find even for myself, the way that I'm best able to process my feelings is just to start to write it, to get it out. So if you're finding that you're having a struggle with that or you need your own time to process your emotions and maybe the ways you're doing it aren't helpful, then I would definitely recommend journaling. And just try it. Sometimes people are like, I don't want to write, but journaling doesn't have to mean just writing it down. It can mean doing a voice note or a voice memo, but it's about getting it out and getting it out of you. It's really going to help with overall mental wellness.
Excellent, excellent. One other question here. Do you have any advice for how to explain a recent diagnosis to children For instance, if you have the eldest is 6 and you want to help them understand without frightening them.
Well, I think it's important to keep it simple and we want to keep it on their developmental level. So it can be something like there are going to be times when I'm not feeling well. And the way you'll know that is I'm tired. I may not have as much energy. So the way you can help me can be, if I ask you to get me some water, help me. I might need you to give me some quiet time. But I think it's about being really specific about maybe a few specific symptoms. You don't have to give the whole name of the diagnosis, what that may look like, and most importantly, what the child can do to help. Because children want to feel a part of it, they want to feel they understand. And the more they feel like they can help in the journey, the calmer they'll be.
Mhm. Great. Thank you again. Thank you so much. This has been very helpful.